professional doesn't speak Spanish and the client doesn't speak enough English, you have no idea what's wrong with them. So you can't treat the problem. A woman can point to her stomach and say, mala, mala, which is bad, bad. But you don't know if that means she's been vomiting, if it means she's having diarrhea, if she's having menstrual cramps. If you don't know what it is, you can't treat the problem, so it's all guesswork. In order to be sure you're getting the right story, you have to have someone who can speak that language, but to whom the patient would have no need to try to hide the cause.
Hola, me llamo Joey Krakowiak. Yo soy un estudiante médico. In Spain, I spent 4 weeks in Salamanca, and I spent 2 weeks in Sevilla. It was really cool because we got to stay with families that lived in those towns. It was just amazing to get to experience a different culture, and you're experiencing a new language. And I mean, I had learned Spanish before going to Spain, but it's definitely different. In school, they don't teach you, at least I wasn't really taught to speak Spanish. I was taught to read and write Spanish. And so that was the biggest learning curve for me. I am from Powder Springs, Georgia. I went to Emory University, graduated in 2010 with a major in neuroscience. I joined Teach for America and started teaching in Nashville, Tennessee. And then after 2 years of teaching, I started medical school. There's a very low number of minorities in the medical profession. There's a huge need for doctors to be able to speak Spanish. People will come to the doctor and they might not tell their doctor that they can't understand what the doctor is saying. A large part of what Teach for America taught me was how to be a leader. One of the things that they emphasize in their program is that we aren't just teachers, we're leaders in our classroom and outside the classroom as well. I know that I'm going to carry that into what I do as a physician, because I don't just want to treat patients, I also want to be a community leader, and I look forward to being able to fill some of that gap.